We are all so busy these days, and we're always looking for helpful tips and advice on how to find a better work-life balance. We all have to earn a living and pay the bills, but are you doing enough to look after yourself and your health at the same time? Now, many of us prioritise careers and work, and we're slaving over our computers and mobiles all the time. But does this make you cut corners on your diet, exercise or sleep? I'm Dr. Ben Sinclair, and welcome to Health versus Wealth with Dr. Ben. Our guests share their life experiences and we discuss their challenges in their health and their wealth. I hope their experiences will help you with your life and health. Welcome back to Health versus Wealth with me, your host, Dr. Ben. I'm delighted to be joined by Beth Muir today, who's a clinical Pilates instructor and also a breath coach and a physio. Beth, delighted to have you here today.
Hi, thank you for having me.
Thank you so much for coming in. Now, we met because we actually worked together. I run Dr. Finlay's private practice, and I was so excited to hear about this hybrid service that you offer.
Wonderful.
I'd love to find out more about you and about what you do today. And I think our listeners will be really interested because you do some very interesting stuff, which is really helpful for people's health. We're talking about health versus wealth, and a lot of the stuff you do can be absolutely fundamental in people being present and delivering in their work roles. Now, let's take it all back. You started your journey towards this a long way away, didn't you?
Correct,
Tell us more about where you grew up.
Yes, I think most people are normally surprised to hear that I grew up in Borneo. I was born in Brunei, lived there for the first couple of years of my life, and then moved to Hong Kong with my family through my father's job. Lived there until I had to come back for secondary school. One of the wonderful things about living over there was just the climate, the culture. Used to get home after school, go for a nice swim, head down to the beach.
Lovely.
You know, it was wonderful. Also a lot of travelling. So I have been told by my parents that my passport was pretty much full by the time I was one, which is quite incredible.
Fantastic.
I think because of that love of travelling, I've done so much more now, which I think has helped possibly with the career that I have, the career path I've taken, with having experienced lots of different types of people, cultures, that sort of thing. So yeah, an interesting upbringing, but which I'm very grateful for.
Definitely. Now, you mentioned the sea. I know you're quite sporty and you were quite a keen swimmer.
Correct.
But I think something changed the course of your swimming career. Tell us a bit more about what actually happened there.
Yeah, of course. I've been swimming competitively since I was about 7. Reached quite a high standard, did lots of kind of badges and things when I was younger. When I moved to the UK, I joined a really good swimming club down south. When I was 15 years old, I was doing a length butterfly and something happened to my shoulder. I just felt a lot of discomfort, a lot of pain, and it didn't feel or looked right, and it had dislocated.
Ouch.
Very, very sore, very painful. And I had to have a lot of rehabilitation. I was told that I wasn't going to swim again.
And I hate those kind of statements when medical professionals just put a barrier on what you're allowed to do.
Very much so. And I think with that experience and having been told no, I'm definitely a physiotherapist that tries not to say too often. You have to sometimes say maybe not, but that
adjust this or
definitely.
Yeah, I always hate it when typically surgeons say, "Oh, your knees are shot, looking at an X-ray," and then someone says, "Well, I can't do anything, can I?"
Yeah, it is a big challenge.
It didn't happen for you though, because you're still running. You're training for a marathon at the moment.
Yes, I am indeed. I'm definitely a swimmer at heart. So this is a big personal challenge. I've joined a local swimming club again, so I've only just joined them, so that's another challenge, and that is actually to complement my training to run the London Marathon next year. Okay. It's a big personal challenge because anybody that knows me knows I'm not a natural runner, but I know about all the benefits of running, and also I treat a lot of clients that enjoy running, so I think learning about running myself and my challenges and how it affects my body is just helping me improve that management of that particular clientele as well.
Absolutely. I know you deal with a lot of sports people. Can you tell us a bit more about the sort of people who you tend to treat?
Of course. So over, I'd say probably the last 3 or 4 years, I have begun to specialise a bit more in pelvic health. So this does tend to come into the realm of women's health. I treat a lot of women when they're pregnant, when postnatally as well. also helping people perimenopause, around that menopausal time. So that's kind of one niche area that I've got. However, there's another area that I really, really enjoy, and that will be working with kind of sports people when they've had an injury. So I do see quite a lot of skiers, I see a lot of runners, not so many swimmers recently, but I have had a few swimmers and tennis players. So just people that enjoy sport, a lot of the time complementing their work. So I do have a few sportsmen that are performing at quite a high level, but I'd say actually the majority are people that have come from a sporting background. They might be that little bit older and they're juggling their work and their sport.
Yeah.
And it's me coming in to help them still continue what they enjoy and manage and be proactive with stopping them from getting further injuries and helping with that management.
So it's injury prevention and rehab, and
definitely
and adjusting to how they do the sport now.
Yes.
And this is exactly what we're about at Dr. Finlay's. We love that integrated care. You mentioned perimenopause as this time. Postmenopause, different challenges. And for men, pelvic health is also important, but not often talked about. And this is what I was really intrigued to know about, because I've never heard of a male sort of pelvic health service before. So tell us a bit more about what you might do for men in that scenario.
So what I'm finding with treating gentlemen that will come to me with back pain or just pain in general, one of the first things I'm looking at, and it's with my pelvic health knowledge, is how are they breathing? How are they managing their pain? And do they have awareness of their pelvic region and how it moves? Pelvic tilting. Everyone always talks about lower back pain. Oh, and this is a good stretch for this and that. But it's almost with gentlemen, they don't go further and think about your pelvis. You still have a pelvis.
No, it's just the back.
It's the back.
Yeah, exactly.
It's the back is the problem. Being a clinical Pilates practitioner, I'm finding that I'm really trying to promote and get gentlemen to come to my classes. Now, a lot of gentlemen tend to like the one-on-one treatment first, and then they get the confidence to come into a class. But I really want to start telling people you don't need that confidence to come along to a class. My classes especially are very, very inclusive. So for gentlemen, we need to be getting them forgetting that idea that Pilates is just for women. It's not. Pilates is for everybody.
Yeah.
I've spent time doing Pilates for different sports teams, male football clubs. I've run a few specialist Pilates events for runners, and in that class, there's about 80% men that come along.
Interesting.
Whereas in general, I normally get 8% with all of my classes, whereas 80% felt it was okay to come to the runners class.
Interesting. That's why do you think that is?
I think again, it's gentlemen don't feel that is the place for them. They think it's women go to Pilates because it's about the pelvic floor. Okay. It's about their pelvis. It's about breathing.
Class.
Yeah. And whereas actually it's so good for everybody. And I think gentlemen especially need to start caring for their body and listening to their body. And maybe that's what's hard about a Pilates class versus just going for a run or going to the gym. That classic workout that gentlemen tend to lead towards.
And I was a bit of a typical example of that. I rode for the university, had big strong legs and arms, but a really rubbish core, and got horrendous low back pain. And I did actually go to a Pilates class with my wife.
Did you? Yeah,
about 20 years ago. And I was, I think, the only bloke there in those days. But these days, I actually went to a hot yoga class, and I was surprised how many men were there. So men are definitely becoming more aware of the need to look after their backs and pelvis.
Definitely. And I think it's just getting rid of that taboo that it's just for women, and giving people that confidence to build into coming along to a class and not feeling that they're going to be the minority. And also, if they are the minority, that matters. It doesn't. And the more people we're getting, the better.
Beth, more about your journey into the therapeutic world. I know you had some relatives who were in health and also in teaching. How did that influence your journey?
I've got a very close relationship with my maternal auntie, Auntie Lyd or Lydianne. She is a nurse And I've grown up my whole life always going to her if there's a problem. Although, ironically, now you think that's not my area and how much do we get that? But she was a phenomenal nurse. She's recently retired, actually. But she began to specialise with working with mothers and babies.
Okay.
And I think just listening to the big changes that she made really inspired me that once I was a physiotherapist, I wanted to go down that women's health route. I also come from a large family. I mean, majority of my family are teachers. And I think maybe that's where that has organically progressed as well, that I have that knowledge from seeing them being teachers, listening to them talking about it. So that side of teaching has definitely enhanced and brought me to be that Pilates instructor.
Interesting, and the fusion of the two has created this sort of hybrid, because you've fused two disciplines, sort of physio, Pilates. It's really interesting fusion combination. I wanted to ask you, you're running a business, you're promoting self-care and how to look after yourself. What habits do you have to help maintain yourself whilst running your own business?
Yeah, of course, I'd love to talk about this because I feel it was a really big challenge as a self-employed person running their own business and making sure that I wasn't getting completely consumed by it. And I think for anyone just starting out, you always say yes to everything. Yeah. I was fitting clients in whenever I could. And to be honest, not at times that suited me, which meant, although I wouldn't allow that person to know, I was exceptionally stressed. I was rushing around. I had my phone on me all the time. I think nowadays with so many social media avenues, anyone can get hold of you. It's Sunday
scary,
night.
Isn't it?
Ping!
Yeah.
I've hurt my ankle. Can you help me tomorrow? So I took the time. I actually bought a new phone. So I've now got a work phone and a personal phone. And I'm very strict that if I'm only holding my personal phone and I quickly wanted to message someone, no. If I don't have my work phone near me, there's a reason for that.
I like that.
When I am managing at home and I'm having that other role, being a mother, I actually put my phones completely out of the way. I don't need to have that. I don't need that distraction. I've taken time, and it is hard. I'm talking about it now. I've had my own company for quite a long time. I'd say in the last 4 years, I've just really made sure that I have those boundaries and I have my work hours. So within reason, no one is coming in outside those work hours. And I think that's vital because when I was working really hard and yes, bringing in the money, getting that satisfaction in that way, I couldn't really enjoy it because I was so stressed and so worried. And I think with the nature of my job, I am very passionate about providing very good care. And if I'm not in the right headspace and if I was stressed out and my health was struggling because I was always focusing on that next earning, it didn't work.
No, totally. And you mentioned stress there. Post-pandemic, there's an epidemic of stress now where the boundaries that you've just talked about have been lost through people maybe working from home or things being shaken up. Flexible working, there's winners and losers. You mentioned earlier about breathing and being a breath coach.
Yes.
How important do you think breathing is to business?
So vital, and I think people don't bring that connection together, and I love that idea about health versus wealth. And actually sometimes I use that phrase and I say breath equals health. I think we take breathing for we just think it happens. We don't, unless you have a problem and you can't find your breath, you take it for granted. We breathe in, we breathe out. I think with regards to business and stress and how we breathe using the top part of our lungs. We're not breathing fully. Every system in the body relies on oxygen, whether it's cognition, digestion, muscle power. And if we're neglecting it, we're neglecting all of those areas. I think also with cognition, we then look at sleep hygiene.
Of course.
So I think we start with the simplicity of breathing.
Yeah.
And we think, well, why do we breathe? What are the benefits? And then you look at that. And I think working in business, if you're not getting that oxygen and you're not feeling all of the beautiful benefits from breathing functionally, you're not going to be working at your best. You're not going to be your best self.
No, totally. And your brain has such a big blood supply that if stuff and creativity is coming from here, if it's not going to get oxygen, you're not going to be delivering, are you?
You're not going to be as creative at all, no.
Now, you're a breath coach. I know, about shallow breathing, about deep breathing. Can you demonstrate some of these techniques to us today?
Of course. And for all the listeners, I want them to follow along what I'm getting you to do, Dr. Ben, or just myself. Simply, you get one hand and you place it on the top of your chest. Other hand around about your belly button. Keep the shoulders nice and relaxed. For really good breathing, especially what I do in the Pilates classes, you breathe in gently through the nose. And then you breathe gently out through the mouth through pursed lips. What I want you noticing, so always perfect breathing is noticing how you breathe to begin with. So is the top hand rising and falling, or are you beginning to get what we call a nice belly rise? So you have to breathe more deeply to allow that belly to rise gently. We're not forcing it out. And as you exhale and you feel all the air leave, the belly relaxes. So we're trying to take the emphasis off the top hand moving, and we get that bottom hand rising and falling. I talk about the effort of breathing in and feeling that rise, followed by the ease of that calm that comes around the body as the air escapes.
Lovely.
So it can be quite simple to begin with. We're doing it in an upright position. You can do it in lying down. You can do it in side lying. I love doing this with people lying prone, so you can feel the belly rising into the fall. And we know that lying on our front is very good for oxygen consumption around the body. So yeah, that's the most simple way to start.
Fantastic. That's a really good demonstration. Thank you. And I feel like my belly is beginning to sort of expand as I breathe in.
You have to let go, because we always think posture, and Dr. Ben, you're sitting up nice and tall, so you're kind of thinking, that's, it's harder, your core engaged, but it's allowing that belly to rise and fall, and that's meaning you're using more of the lungs. They're lengthening, they're expanding.
It's quite hard to isolate your belly whilst trying to maintain good upper body posture.
It is tricky.
Holding it too hard in some places. I need to relax into the breathing perhaps.
And that's where you can challenge people with the different positions. So it might be, this is quite a tricky position for you because you're having to sit upright. Whereas maybe if you were relaxed supine on the floor with your knees bent, your head and your shoulders would be relaxed. So you could then tune in. And I think that's a really interesting point that you've said. Yes, we can try and breathe effectively, but actually it's a whole body thing. Are you in the right position to breathe? Is your head ready to breathe?
And the right frame of mind is so important, because if you're not focused and grounded, then you're not going to be aware.
I get people closing their eyes as well, so really tuning in. It could be that you put some music on, you turn the lights off, get yourself comfortable. And it doesn't need to be a long time. Just having some mindful breathing and breathing purposefully for 2 minutes every day just resets and gets you tuning in and changing habits.
I love the idea of the reset. And I think in business, sometimes we go from meeting to meeting or item to item. And actually, we need to reset and re-engage with ourselves to focus before we go on to the next thing.
Definitely.
So would this be something that someone could do just simply, in between meetings?
Of course. I've even had to recently get my son, who games, to do it between games. He's getting flushed in the face. Wow. He's getting excited with this gaming, and I do see this a lot with people now that are gaming. There's lots of things going on there, but it's really opened up my eyes. He comes in all flushed-faced, and you're not breathing, you're holding your breath. So I'm saying to him now, between each game, breathe. So you can breathe anywhere, anytime. You don't have to be self-conscious of it. Once you feel confident with where you're breathing, you don't need that tactile touch. I always start with that. I've even had people with books resting on their belly so they can really relax their arms out so they don't feel that that's tense. Just that little tactile touch. We're breathing deeply.
That's really interesting. I'm sure all the listeners are also now super self-aware, as I am, of how my belly and my chest are moving, having taken my hands off. But it's that awareness that then leads to a change in behaviour.
Of course.
It's a great technique. Now, this is just one thing that you do, and I've been really interested to work with you because we promote breath work as part of stress management for long COVID, for perimenopause, and for busy working people. You also mentioned earlier that you do a hybrid form of Pilates.
Yes.
Tell me more about that. I'm interested.
I get a lot of questions all the time because my classes are physiotherapy-led Pilates classes, and I refer to myself as that clinical Pilates practitioner. People say, well, why are your classes different to a non-physiotherapy-led? I think the biggest thing that I can say is that I come with the clinical background. So in other words, I'm not scared to have anybody in my class, because I go around, my classes are small, I go around and I check. And the most important thing is that the exercises can be modified. So I might have someone in my class who can't kneel. I might have someone in my class who struggles with arthritis in their wrists and can't do that. And I find that with my experience as a physiotherapist, I can have that diverse group in my class, and I can mix up what I need people to do. I also make sure that my classes are very functional. So as a physiotherapist, I might still call the exercise the same. We're going to do scissors. But I'll say we're doing scissors because this is going to help you climb the stairs. This is going to help those of you that enjoy climbing hills.
Oh, I like that. Yeah, makes it real and practical.
That's the biggest thing for me, is I don't want people just to come to a Pilates class because they've been told it's meant to be good for them, and they're out and they're doing it. Why are you coming and why are you doing the exercises? I also try and make sure that everyone is aware that they're there for them. So I will give options, whereas possibly some Pilates classes might not have as many options. I'm saying, do you want to work hard today? I'm giving you different levels of this core exercise. Do you feel that you're coming a little bit stressed? And actually, let's put the arms out. Let's just calm the body. Now you can work the core, but you don't need to push it too much.
So it's really tailored to where they are and how they are. I love that, because often the one-size-fits-all approach might result in like injury, or actually...
Definitely.
So many times I think, particularly men, they might disengage from a class because they don't feel accommodated, or they're already feeling a bit unwelcome because they think it's like women in lycra, you know.
Definitely.
And actually, if they're then sort of adjusted and you know, their injuries are taken into account, they're going to do so much better, and maybe learn some of that sensitivity of when to push and when to hold back, which is a fine art in sport.
I'm really trying to promote the type of Pilates that I teach in the sporting world. I'm really, really pushing it, and I'm trying to say to people, yes, you enjoy your running, you're a tennis player, you're a hockey player. And when I do treat those clients, I say, well, what else are you doing? They're like, oh, well, I stretch out a bit. It's like, hang on a minute. I want people to think of Pilates as a complement to the sport that they do already, not instead of.
It's as well as. And
as well as. I think with the gentlemen doing Pilates, because there's so much variation, and I think as long as instructors are offering variation, I use equipment, which is brilliant. I've got a reformer at home, which sometimes people enjoy as well.
What's a reformer?
How would I describe it? It looks quite sinister. It's like a big long bed, and it goes back to Joseph Pilates' days. He first started treating people when they're in a hospital bed. And he used to strap something to them up against the bed and say, right, pull against that. You can't get out of bed because you've got this and that, but I want you to get strong. So it goes back to that original. So actually, a lot of Pilates was on reformers to begin with. We've modified it to be on the mat.
Oh, okay. So this is a bit like a weights machine with resistance and that sort of thing?
It's got a lot of springs, so it's spring-led. It's fantastic. So you've got a jump board, so you can jump up and down on it as well. So if someone doesn't have the ability to jump up and down on the spot up against gravity, you can use the springs to aid. It's a really nice way to load the body with the springs, with strength, but you're still using the principles of Pilates and those particular exercises.
And I love the idea that this is a sort of an adjunct. It's alongside your existing sport, because I was told when I had a bad back to do Pilates or yoga, and I ended up doing yoga, and it speeded up my swimming in triathlon, my running. I got far less back pain and far less knee pain as a result.
Fantastic, yeah.
So all those things that I had to unlearn just using the power muscles for rowing, and relearn all the bits that connected them in between.
Yes. Yeah.
I almost think Pilates is almost like those connections in between. That's actually the bit that enables you to deliver the power. But if you haven't got them right, you're going to get injured.
Definitely. I say this many times, but as a physiotherapist and Pilates instructor, I'm always saying to my clients or anyone that's ever coming to my classes, let's make sure that we're being proactive with making change, not always reactive. Something hurts, oh, well, I heat it and it makes it feel better. Or something hurts, oh, I stretch it out and it makes it feel better. And I'll always say, well, then don't you continue those stretches that made you feel better? Oh, well, no, because I feel all right. And a lot of what I want to do is just get people taking more ownership of their health. I think with the pandemic, with people being stuck at home, it was scary. And I think coming out, people are being more proactive with, and I'm seeing a lot more people coming to me saying, do you know what, I've got a bit of a niggle, but I want to sort it out. Whereas in the past it would be, oh my goodness, this has been like this for 3 months and I haven't had the time to come in. People are taking ownership and not expecting everyone else just to make them better or fix them.
Yep.
And I'm really pleased about that. And I'm trying to encourage people to have little management plans, make little changes. And as a therapist, I'll always say to people, just little bits. Everyone tries to make a big change, don't they? Oh, I sit too much, so I'm now going to stand all day long with my standing desk.
Yes.
Hang on a minute.
Yeah, we always go way too far the other end, don't we?
Yeah, and I think that's where I help, just getting people to listen to their body. And like you've said, just listen to themselves and make the change that they need, not just maybe on paper what says, you need to do this, you need to do that.
At Dr. Finlay's private practice, we are really excited to be working with you, Beth. And your integrated approach to Pilates and pelvic health really complements everything else that we do. I know that you've also done this yourself for a long time. Tell us a bit about your company.
So 10 years ago, I set up Alexander Physiotherapy and Pilates, and it's only grown, to be honest. I now have a lovely therapy lodge where I invite people for one-on-one Pilates. I've already mentioned I've got my lovely reformer. I do my women's health physiotherapy, pelvic health, pelvic care. And I'm so delighted to be working with Dr. Finlay's to bring all of that knowledge and that experience that I've got for your clients and helping with their needs, whether that's online, whether that's bringing them to my clinic if they live locally. But I think there's lots that we can be doing to really help.
Absolutely, and I'm referring people to you. I'm actually referring probably more men because my interest is men's health, and our female colleagues are referring our female patients to you as well in perimenopause.
Yes.
What sort of health problems do you think men could benefit from your service?
The first thing that I'm going to say is if you say the word incontinence, we always think it's going to be women, and
True.
Usually it tends to be women that have had babies. Which is not the case at all. I'm treating people with incontinence of any age, whether they've had children or not, any part in their life, having hernias and actually how that affects the core and the separation of the tummy muscles.
Yep.
Sometimes it's even as simple as me saying, look, I think you should do this and this and this to help not cause any further damage, or making sure that we're not enhancing what is there already, becoming more of an issue. A lot of gentlemen will take back pain on its own, and I'm like, well, hang on a minute, what else is going on? And sometimes I'll find, have they been looking at their prostate? Is that why they're getting incontinence?
Exactly. Am I right in saying that prostate cancer is one of the things that can really cause problems for male incontinence?
Definitely. And I think sometimes there's not enough support out there as a pelvic health physio, whether it is for gentlemen that have had to have surgery or suffering with bladder incontinence. We've got pelvic floor muscles, and I've used that word, they are a muscle. A muscle can be trained, a muscle can be strengthened, a muscle can be tight. Sometimes people will think that their pelvic floor issues, whether they're male or female, are because their pelvic floor is weak. A lot of the time gentlemen will say, I don't have a pelvic floor, what is it, where is it? So sometimes it's just education at the start.
Beth, it's been so interesting talking today. I want to thank you for everything you've shared with us today. I'm sure the listeners will be fascinated.
Thank you so much for having me. It's been a delight.
Good, but we've run out of time. So thanks for coming. Safe journey home.
Wonderful.
And that's all we've got time for today on Health versus Wealth. So until the next episode, it's goodbye from me, Dr. Ben. So that's it for today. I hope my guest and I have helped you meet some of your health versus wealth challenges. Now, to hear more from me, Dr. Ben, why not subscribe on your usual podcast platform? And if you like my advice or you'd like to be a guest on the show, you can email me on podcast@drfinlays.co.uk. Anyway, I hope to see you again, but for now, it's goodbye from me, Dr. Ben.